Hi everyone, I'm Christina Dominguez. Thanks for joining us for Healthy Aging Week. This is a week we're really focused on all of the resources that we have here at Rochester Regional Health to talk about healthy aging. Joining me now is Sarah Bateman. She's an administrator at the Edna Tina Wilson Living Center. Thanks so much for being a part of our week.
Thanks for having me.
So let's start about, we really wanted this week kind of before the holidays, because we know a lot of families are going to be getting together, right? We've got Thanksgiving and other holidays coming up. And sometimes those are opportunities to have some kind of difficult conversations with family members about when it might be time that our loved ones might need more services. How do we have those conversations? What are your recommendations?
Yeah, those conversations are tough. Aging is tough. No one wants to admit that they're needing a little more help, that they're aging. And I think that families often will come together and maybe they haven't seen mom or dad lately, and they're recognizing maybe the house is, struggling, or maybe there's some bruising, they've had a fall or, something. And I think really the key is coming together as a family. So it's no one person, but coming together as a family and recognizing, mom, dad, I noticed that, you're not able to navigate the stairs as well anymore. Maybe there's something we could do to help. Maybe there's a service we could recommend, or let's look up something and keep you as independent as possible. So I think looking at it as not you need help, but how do we keep you independent?
And what's nice is that there's a lot to choose from, right? So can you talk a little bit about some of the options that people have?
Yeah, so there's a number of options that Rochester Regional offers, from home care, outpatient, to long-term care services. And long-term care services are throughout the region and offer really a gamut: respiratory care, memory care, rehab, long-term care, really throughout the entire region. So there's a lot of options.
What do you recommend for someone who's not quite sure what mom or dad needs, or what I might start to need? Because maybe people recognize it in themselves.
Yeah, I would really direct them to Lifespan. Online, Lifespan has a wonderful thing called Elder Pages, and it has a lot of resources out there that really identify what is assisted living, what is long-term care, elder law attorneys, care managers, community assets that they can reach out to.
So, one of the big questions that people have when they start thinking about their future with long-term care is, will I be able to afford this for myself and for mom and dad or a loved one? How do we tackle that?
Yeah, finances are tough, and no one really likes to talk about them. But there's a lot of misconceptions out there about long-term care and what happens and how to pay for it. The best advice I can give is really do your homework. Reach out, read online, reach out to those folks on the Elder Pages that I mentioned. Get an elder law attorney. Understand what the process is, and it'll make you feel a lot better about it. If you're in the hospital and you come upon this and you're at a Rochester Regional Hospital, we have financial case management team members who, that's their goal, is to help walk people through really difficult situations and understand, what's going on, how it's going to be paid for, and what their options are really.
So, of course, we have all lived through the pandemic, are still living through it to some extent, and so there are still a lot of COVID protocols in our facilities. Can you talk about that, and are these places safe?
Yeah, so you're right. The pandemic has been long, and nursing homes have gotten a bad rap, as a nursing home administrator, that's tough, because we have experts. We talk with the Department of Health regularly. Our system medical director has been recognized for his excellence in infection prevention, and the amount of work that goes into keeping our residents safe and keeping our staff safe is really incredible. Visitation is fully open, but there's regulations there that we stick to regarding testing and masking, and those aren't our rules, but it's important for everyone, not only the safety of the residents, but the safety of staff, to follow them.
And continuing on to that point, our unbelievable healthcare workers who have really gone above and beyond, especially in our long-term care facilities, taking care of patients during COVID and all of that. But now we hear we have staffing issues. Mm-hmm. There are not enough staff members to take care of our loved ones. How are we dealing with that as a system, really?
Yeah, I think there's a lot of creative things that we've been doing to recruit, to help grow our own. We have a lot of initiatives going on related to referrals. We found that the best people coming on board are referrals from our current staff members. Makes sense, right? Our current great staff want to work with other great staff. So we have, really tackling recruitment, retention, employee engagement, making sure employees feel like we care about them, not just for showing up to work, but we care about them as people. We've started a life coach program. We've really just reached out and tried to embrace our staff, not only for the care that they've provided throughout the pandemic, but also ongoing.
Let's talk about this life coach. I think this is such a great idea and a great program that we've recently implemented, right? Can you talk about what that is?
Yeah, so our life coach program, was thought up by Colleen. I want to, definitely recognize her for that, and has been put into action. So our life coach meets with our staff and really helps them with a little bit of anything. Maybe they're struggling to get to work, but maybe it's because of transportation or childcare or some other life circumstance that really impacts their work life. Or maybe it's just something they're struggling with at home that they need to be connected to resources. They need a little guidance. They need that extra support to be successful both at home and at work. If we have employees that are happy at home, they're going to be happier at work and they're going to come to work. So we've had some really powerful stories come from that. Related to the help that have been provided. And it also, it might not even be anything bad. Maybe it's not knowing that you qualify for first-time home buyer or education opportunities or scholarships. The gamut is huge as to what our life coaches have been able to help with, and it's really powerful. And those results are shared with us, so we kind of know what's going on, of course anonymously, but we know the struggles our employees face, but also the wins that they're experiencing.
That's wonderful. In one small way, really, when we're talking about retention of employees or even recruitment of employees, a service we offer.
Yeah.
So we're talking with Sarah Bateman. She's an administrator there with the Edna Tina Wilson Living Center. Finally, what do we want to say in general for people who are perhaps going to be going down this path soon or thinking about it for themselves in the future and saying, what's going to be available to me when I get to a point where I might need a little help? What would you say?
I could say a lot, but I will keep it to, I think doing your research, understanding what's there, understanding, the gamut. It's not scary. I think none of us want to think about healthcare or, things like that until we really need it, but we need to think about it. We need to pre-plan. And just know what's there, know what your options are, speak with the experts, as I said, talk with an elder law attorney or a care manager in the community, get it so it's no longer an uncomfortable conversation, that if you ever need it, you'll know where to go. And
you mentioned also briefly earlier, there are ways of you staying in your home. It doesn't always necessarily mean a facility, right?
Yeah, Rochester Regional offers the gamut, home care, Elder One, and yes, long-term care or rehab after a hospital. As we age, something like a UTI or the flu can really knock you down. And I know everybody wants to leave the hospital as soon as possible, but maybe that 2-week stay in rehab or 3 weeks or whatever it might be might keep you at home now for years to come. But if you skip that step, now maybe you go home and you're not able to stay there. So I think really looking at it as how do we maintain the highest level of independence possible, and whether that's at home or whether that's even in a facility.
Thank you so much. This is such an important conversation, and we're going to be focused on this really throughout the week. So please make sure you join us for all of our other healthy aging social media posts that have great information and other interviews you'll be able to see on Facebook. Thanks for joining us.
Thank you.